Hello, Nav here, plastic surgeon. Welcome to the Real Clinic podcast, sponsored by 42 South Films. This is where we take a behind-the-scenes look at the surgery industry, get to meet key players in the business, learn about setting up a clinic such as Real, and meet some of the best surgeons around. Welcome to another episode of the Real Clinic podcast. My name's Nav I'm plastic surgeon here at the clinic. And today we've got a really special guest. We have Laura Summers, who is a 24/7 virtual nurse for plastic surgery, cosmetic surgery. An interesting concept that you might not have thought about or heard about, but we're going to find out all about it today and how it actually works, because I've been working with Laura for at least the past 3 years and it's been going really, really well with my private practice. So welcome, Laura. Thank you for coming.
Thank you. Thanks,
and it's one of those things where we work together, but your nursing service, you look after, for example, my patients pre and post-op.
Yes.
But it's a virtual nursing service as such,
It is.
Which makes people nervous like me. But actually, I must say I'm totally bought into it. So we'll get into that and we'll tell people why we think it's a great idea. But before we do that, tell us about yourself. Okay, give us, go far back as you like. Who are you? Where'd you come from? What's your name, etc. Like Cilla Black.
Thank you. Thanks for that lovely introduction, Nav. Yes, I'm Laura Summers and registered nurse.
Uh-huh.
I trained at Bournemouth University and qualified in 2013.
Mm-hmm.
So worked in oncology to start with when I qualified. I really enjoyed oncology, very rewarding role as a nurse. However, it's a really difficult role, NHS nursing and being with people that have really difficult prognosis. Yeah. So I sort of, I'd actually had my second child at that point. Okay. So I had a child very young as well. Yeah. So I was actually 18 when I had my first child. Okay. Which is quite an interesting thing to do. It wasn't obviously on the life plan, but these
makes
things
life
happen.
A bit harder,
It does, but I did go to uni with a child as well, which is always, again, sort of a challenging thing to do. But when I qualified, I then had another child as well. So started a role in a day unit in oncology and just found it really emotive. So I did that for a few years. Felt a little bit like... what you think you're going to be as a nurse isn't, you're not really able to do what you want to do, because you want to give a lot to these patients, and can you always do that? So almost fell out of love with nursing about 3 or 4 years after I qualified. So then ended up sort of stepping back a little bit and deciding to make a bit of a life choice. Was I going to go back to uni now with 2 children? And actually then got a job at Harley Medical Group. Okay.
Well, I used to work with them as well.
Yeah. So, and it just reinvigorated my love for nursing, which was brilliant because I didn't really want to train again in anything else. But I worked in Southampton Clinic, which was the closest to me because I live in Bournemouth, and loved it. It was the best job I'd ever had. Loved the patients, loved the industry because you really felt like you were making a difference more than I'd ever done before.
That's interesting. We'll come on to that actually. So before we get too far ahead, sorry to interrupt, but we'll come back to because we haven't quite finished your story. So what I'm just going to, just so we can dwell upon the oncology bit, I won't dwell on the stuff that you didn't enjoy, but what was it that you didn't quite like about the oncology day nursing, I think it was, that you said you were doing? Tell me exactly what it was that you felt like it just wasn't your thing.
So we had an excellent team. The nurses were amazing and the patients were wonderful.
Yeah. Doctors were horrible.
No, doctors were lovely as well. It was a nurse-led unit though. Okay. But actually it was more the, when people had a really poor prognosis, I'm quite a positive person and I used to find it really hard to support the people. I think I'm quite emotionally intelligent. I would say that's one of my skills. Okay. So supporting a patient that's got a really poor prognosis when there isn't much you can say to make it better. So I found it really difficult to be in a situation where these patients are going through the worst time of their life. And whereas in what I do now, I can say you're going to heal.
Yeah.
You will heal and you will be okay.
Yeah.
I can't tell you when, but I can say you will.
Yeah.
And I think in oncology nursing, that was really tough for me.
So how come you ended up in oncology then? Was that just by chance?
I did actually have a friend who was the sister on the unit, and I'd done some work there before I'd trained actually as a ward clerk. So before I went back to uni, I actually went and
so that was a familiar-ish.
It was a familiar-ish, and I did like the nursing staff on there, and I liked the unit. It was a really good unit, but I think being in it every day, is quite. I take my hat off to anyone that does those roles because, it's an amazing privilege to be at that, with people when they're going through that. But I think it also takes a lot from you as a nurse to support people in the way that they need you to. I think I want to solve things for people. Yeah. Okay. And you can't.
Yeah. And so again, if we, and tell me if you don't want to talk about this for too long, but what I was going to try and pick up on was you went from being, let's just call it an NHS nurse to being a private aesthetic nurse. Now, a lot of people do that, not just nurses, but a lot of doctors do it. And I know, for example, plastic surgery trainees who didn't enjoy the training in the NHS and have given up, dropped it, and have gone into aesthetics, Botox fillers, that kind of practice. Yeah. And a lot of those people get a lot of criticism from a lot of my peers in the NHS, for example, not necessarily just in the NHS. You might hear, and this probably doesn't apply to you, but let's just think about that bit. But you'll hear a lot of criticism, and I criticize a lot of people like this as well, because, there are some people that make out that they are plastic surgery trained and this and that and the other, and they're not. They've dropped out from NHS practice, they haven't been fully trained, and now they're doing an aesthetic practice. Forgetting that, and that's not what I'm trying to get at when it comes to you. And you kind of started to tell me this, but how do you? So if I start saying, "But you're not a proper nurse anymore, are you?" And I'm sure you've heard that.
Yes.
So and I'm sure you'll tell me, no, you absolutely are. Yeah. Okay, but tell me why you still think what you're doing is proper nursing.
So,
if that's the case.
Yeah, no, of course. And you do get that, because I think I even used to say it, I am a nurse, but I work with a private company now. Yeah. So I think I even, and you do feel there is a stigma attached to it, but I think it's a stigma attached to plastic surgery, if I'm honest. Okay. I know I'm a proper nurse because I believe what nursing is at the heart of it is supporting people for a really difficult time. Yep. And it's no one to judge what a difficult time is. Yeah, absolutely. So people don't go through the procedures that we know they have because, yes, there's always going to be the patient that's had plenty of procedures and it is purely vanity. But most of the people that work in this industry know that it's a lot more than that. And I think that that's what I've always been really passionate about, that people are in a situation where they, feel that they have to go through this because it affects their life so greatly, to not change that part of them. That's when I realized that obviously to go from being an NHS nurse over to sort of working with plastic surgery patients, there is a big part of the industry that isn't being sort of looked after in the way that they should. And supported, because there is this stigma. So you need specialist trained nurses to support these people that are dealing with, this big life event, as you said the other day.
I think, I know the answer to this question because I work with you, as it were. But I think, and again, tell me if I'm speaking out of turn, but one of the things that I've certainly noticed over the years in private practice is the quality of the nursing isn't as good as the quality of the nursing in the NHS. Yeah. And, and we do get, certainly in I'm not going to name names or particular locations or anything, but if I think of all the various hospitals I've worked in, all the various clinics I've worked in, you do quite often find that a lot of the nurses who have ended up in the private sector are doing it because it's a simpler life, an easier life, maybe the pay's better, but that aside. And so as a result, you don't always get the proper kind of dynamic, really good nurses that I encounter so often in NHS hospitals. And so is that what you feel you're now bringing to the private sector?
I think I feel I'm bringing passion and I think empathy, because I think and I hear you on that, because I know that I've seen it with nurses where they've gone, well, this patient's done it to themselves. So why should I give them? Why should I give them good care? You know, and there is that patients are dealing with. So they're choosing to go through something quite significant, which hasn't been a decision that they made yesterday. They've probably thought about this for many years, and then the care they receive afterwards is quite sometimes inadequate, and they feel that stigma that they already felt prior to the surgery has just been, they've been treated almost badly afterwards, like, get over it, you've chosen to do this.
And do you think, because I personally think that sort of stigma of cosmetic surgery versus other surgery in the private sector is perhaps less so or less prevalent in London. I wonder, maybe because we've got places like this clinic, which do a lot of aesthetic surgery, a lot of plastic surgery. We do a lot of other things here, but we do a lot of aesthetics. And so as a result, perhaps the setup we've got here is a little bit more geared towards it. So do you see that London versus not London difference maybe?
I do, actually. I agree again. So again, I live in Bournemouth. I've worked in some local clinics, and that it's definitely a lot more old fashioned in their thought process. And some of the nursing staff, you can definitely tell that there's a difference.
And are you noticing, so there are some newer clinics opening up. So Charlie Durrant's place, Ad Nova in Portsmouth. I'm guessing you've not had the chance to work in that clinic.
No, okay. I haven't. That's a bit further away.
I'm hoping to get Charlie on this podcast at some point, because we both built clinics sort of in parallel. And so we just want to share our pain and all the lines on our forward. Yeah, absolutely. So I'm wondering, actually, I suspect, even though I'm seeing a difference, or I have seen a difference, and you're seeing a difference between, the big cities or London versus outside, I bet you that's going to get better. That difference is going to get less, because there are more and more and more plastic surgeons, for example, building their own clinics, and I think doing quite well for themselves. So, okay. So, talk me through the rest of your story. So we got as far as you went to the Harley Med Group and you loved it in Southampton. And then carry on the story.
Working in Southampton, really enjoyed it. Lovely team, loved the patients. We had 2 surgeons that would come to the clinic once or twice a month. So, just really started to really understand this industry, and really started to feel that you could make a bit of a difference. And because the way the Harley Medical set up their clinics, you are the only nurse on site at that point. So you're working sort of independently, which obviously is quite scary to start with when you're learning.
They work you hard, don't they, as well?
They work you hard, yes. There was me and another worked me hard, but really enjoyed it, and just really enjoyed the patient journey, because you get to do the sort of patient counsellor role as well, which is what they call it.
That's the chaperone role, isn't it, in the room?
The advisor. So, I would actually pre-consult a patient as well. So you sort of learn all of that.
And then I'm going to just dwell on that for a second, because that's also been criticised by a lot of my colleagues over the years. Because I always thought that the Harley Med patients that I consulted with a chaperone like yourself, who'd been prepared before I'd seen them on the telephone or even a face-to-face quite often, and had maybe tried a few sizes on, and just had a very informal consultation with someone like yourself. I always thought they'd been really well prepared, because actually they were very well lined up patients, very well informed almost, and they were quite, the indecisive ones, or the ones that were going to waste your time, had been sifted out. So it made my clinics a lot more efficient. So do you think, just tell me about that role, what did you call it?
So pre-consultation.
Pre-consultation,
Yeah. So, again, when I came into it, I found it quite interesting that I was a nurse and I was being told it was sort of a sales role, which is interesting because that's the slight ethical bit, I guess, that, but the consultation process, I think, is great to be done by a nurse or an experienced advisor, because, we can sift out and you can really get a rapport with that patient and work out if they're a good candidate. So there's stuff that a patient, I think, will tell a nurse that won't go in and speak to a surgeon because they feel a bit intimidated. So actually, I really enjoyed that role, because I really felt that you could engage with that patient on a different level and check that they were, I'd ask them questions like, who's going to support you afterwards? Does anyone know that you're having this done? And I felt that they would be quite honest to me. So I do think you get a really good patient selection from doing that.
Yeah, I think so.
I loved following that journey from pre-consultation, pre-op, and then obviously week 1, week 6. Really enjoyed it. It was a really good role.
And then what took you away from Harley Med eventually?
I think I just wanted to see what else was out there. I sort of got, the clinic was changing, things were happening in Harley Med anyway. And I think I started to then think, well, perhaps I'll go to London, start to see what else is there. So I worked in a few, with some independent surgeons in London, some good and bad experiences of that.
And so, let's talk about that. What makes, in your opinion, without naming names or locations, but tell me afterwards. What would you call the good? What made for a good experience? What made for a bad experience? And from my point of view, I'm interested in knowing what made the surgeons good and bad. And you don't have to go into gory details, as it were, but general.
I think, again, like new clinics starting, and some of these were new clinics, and teams are really important, and obviously having enough staff and things like that. So the good experiences came from places that you felt there was a really good team. And I mean, in the place that, I won't name any names, I did have a very good fellow nurse, but we were sort of in many roles, which was quite an interesting
And this is a relatively new startup.
It was a new startup, but you were sort of doing the pre-op. You were doing I hadn't done much scrub nursing before, but I did take on a scrub nurse role as well. We were also doing the recovery role and the seeing patients afterwards role, and sometimes you would sort of nip out.
Okay, so you're suddenly being pulled. I mean, this is sounding familiar in a way to me, because being a new clinic here, we've had to do a bit of that. We've tried to keep it safe and within people's skill sets as much as we can, but we've had to kind of get people to adapt a little bit on occasion, because we're a small setup. Of course. And I think adaptation is good, adapting is fine. It did feel I know your setup here, and it's very safe, I feel it's very safe setup here, and doing different roles is actually quite interesting, because you get to see and get to know what to do, but it was sort of quite it was a different. So is that an example of the bad? Or is that the okay? That was the not so good.
That was not so good. But there was, I had this great friendship with this other nurse, and we were doing an awful lot together, which carried us through. I learned so much there, and again, I loved being in theatre, because that, now from what I do, it really helps knowing as many roles as I know. Because I can relate to these patients, because I've seen it as well, and I've seen a lot of surgeries and sort of assisted with some.
and then what was the better example? Why was it better?
Again, just a really good team. Team. I think having a really close knit team where you've got people that. You've got established anaesthetists that, are always the ones that come, and they can sort of control the room. Things like that, I think from a nursing perspective, make you feel safer, make everyone feel safer. And obviously lots of the surgeons like yourself that I work with now are very choosy on their anaesthetist, for example, because the anaesthetist is going to make the big difference for you to be able to do what you can do without worrying. So I think there's a real feeling in theatres of feeling safe, and I think that comes down to the nurses as well, that you feel quite confident.
And then what happened after that?
I think after working at a few places, I realised that there was this niche in the market, and I thought, do you know what? I love looking after patients. I really did think I enjoyed being in theatre, but actually I knew I was quite good with awake patients. So as much as I love the humour in theatre and, you know, it's a bit different than when I'm used to seeing patients awake, I decided to sort of make the jump and set up a business, which is a bit of a scary prospect.
And when was this? What year are we talking about now?
So it was 3 years. I think I'm coming into my 4th year now in June. So, yeah.
And so tell us about the idea. Tell us about I don't know how you set it up and the evolution, and because I'm sure it's changed over the last 4 years. It has
changed, yeah.
So talk us through that journey, evolution.
So I think I was running one day because I like running, as you know. And I came up with this idea about providing private wound care to patients in their own home, and realising that there was this growing industry where patients were having surgery, and especially in London, there were places popping up everywhere, and actually thinking these patients probably could do with being seen by someone in their own home, so they didn't have to travel back to a clinic. That would be lovely for them. So decided to go down this sort of home care route. I was thinking district nursing, but for private care was my thoughts.
Okay.
Set it all up, set up the website, decided I probably would need a CQC registration, which you start looking into that and you think, oh my goodness, that's like quite a thing to do. And then started to pitch into some surgeons. I had some surgeons on board in quite early days that I was going to run this service for. The downsides of it was that I had to travel a lot and I was driving around the country because you can't turn down work when you set something like this up. So going out to patients' houses and still getting messages on my phones from these patients that were starting to build up. And realised that it probably wasn't sustainable to start doing both, and realising the amount I needed to charge, and it felt a bit unethical, I suppose, to sort of charge, because I was in the car all day and I live in the south of England. So there was sort of lots of things that were sort of, you're starting to realise that you might not be able to.
So the travelling nurse thing wasn't working out.
Well, the idea, I think when I set it up, was I'd have little pockets of nurses around the UK, and you could sort of, you know, just pick. Have a network of nurses that you could ask to go and see patients. You know, things evolve. And then I went and saw one surgeon to sort of pitch the concept to, and he actually said, I don't actually want you to do this. I would like you just to manage my patients afterwards. And I sort of already started to realise that the patients that I was managing and seeing them in their wound checks were messaging me lots of messages and sending me photographs and asking me lots of questions at sort of 6-7 o'clock at night. 6 o'clock in the morning, Saturday afternoon, you know, times when clinics weren't available. So I sort of thought, okay, let's start running that for this surgeon. So I started doing that. And that was going really well, and really liked the patients that this surgeon had. He does a lot of post-skin removal surgery. So they've had bariatric surgery, and then they're getting a lot of skin removed. So we're getting big wounds. They don't always heal well, and these patients do need a lot more support. And this consultant, it's him and a PA, and he wasn't getting much support from the hospitals. So this was a really good sort of gap filler for him, I guess. So sort of evolved from there.
And then now,
when
it must be 2 or 3 years now that you and I have worked together. So I'm guessing not long after you'd set this up. We, from the beginning, you were not seeing my patients at home.
No.
You were just managing them via WhatsApp, FaceTime, whatever. But it seems to go really well as far as I'm concerned. You know, the amount, and you know, I'm sure a lot of my colleagues know, you can tell an awful lot from a picture, from talking to the patient. And you can work out if they actually ought to go and see someone properly or not, and so forth. So how is that going? Because I'm sure you work for lots of different surgeons now, myself included. I can tell you about how it's going from my point of view, but yeah, how's it all going? What are you up to now? So what's it evolved into?
So again, it has really kept that same concept.
Yep.
And so it's 24/7 virtual
Yep.
support service is
Yep.
sort of how I sort of
Yep.
speak about it now.
Yep.
Obviously that involves a pre-op call with these patients.
Yep.
So you build a rapport beforehand.
Yep.
There's always more questions that they haven't asked and that they've forgotten to ask.
Yep.
So I can cover lots of those off. You know, most of those sort of questions are quite general things.
Yep.
So you build that rapport, you pick up who's going to be particularly anxious afterwards. You find out a bit about their background and why they're choosing to have this. So that is good for me because I sort of know what support they're going to get afterwards. And then, obviously managing them throughout their journey of recovery.
Yeah.
And that involves me touching base with them, but also them knowing that this is a service that they can utilize at any time, really. And, you know, that does enable them to have a less anxious recovery, because I think the anxiety that patients face when they're choosing to have these types of procedures is as well, like, you know, who am I going to call? And sometimes it's not an emergency, but it's also something I really want to know now. And the PA of the surgeon, you know, and I saw one wound care nurse last week, but I don't really know who to ask this question to. And it's opening up those lines of communication for these patients to give them a more supported recovery and just so that they feel really cared for.
And so if we now look at the group of patients that you treat, and talk me through kind of what works really well, okay, and I'm sure there's loads. And then also we'll get into the sort of the other side, which is looking, and I'm sure you discovered all of this as you were developing and growing your business, the kind of things that just, you know what, I'll probably ask you to give me an example, again, without giving away too much specifically, of like something that was a nightmare that you sorted out, I'm sure, but it was a nightmare. So tell me, first of all, in what way does it work really well? You know, because what I would say is I notice what you do, okay, as a surgeon that works with you. And I'm not just saying this, but I do, because I look after both my own private patients and I'm looking after NHS patients in this clinic, because we're doing both here. The NHS patients don't get looked after by you because, you know, that's an additional cost service that they don't want to pay generally. But my private patients, actually, we generally don't give them the option. It gets priced into what they've paid as an overall fee. So I do see the difference, the number of phone calls that the clinic gets from the NHS patients, and they've not necessarily had anything particularly more complicated. It could be a breast reduction, but the NHS breast reduction versus my private breast reduction, I can tell you, are a different group of patients.
Yes.
The private ones are sorted, calm, happy. They're not constantly hassling my secretaries, but the NHS ones are, you know, not constantly, but you get the idea.
Yeah.
So, I mean, what I want to know is, and I don't see this, is what's the magic that you're doing, okay, to my private patients to keep them happy? Yeah,
I think it is giving people time and listening to them. I think it actually, it sort of disarms people. Yeah. So I think when you're having procedures like this, you are anxious and you're expecting something to go wrong. Yeah. There's a level of expectation that something bad's going to happen. So they go into it, and I think it is because they're putting themselves through it. Yeah. And so something must go wrong. I don't think they feel the same when I've worked in the NHS with a different surgery. I think that this is specific to plastics. Yeah. So I think what I try and do with these patients is really just make them feel that I am available for them. So you don't have to have that anxiety, because I'm going to, you know, whatever the question, I'm there for you afterwards. Yeah. You know, you're not going to be on your own, and we will work through it together. Yeah. So I think when you enable people to feel supported, that it just disarms the anxiety in them, and it enables them to sort of, you know, they bombard you with questions prior to surgery. And when you say, I'm happy to talk to you about it all now, but what I prefer to do is talk chew through it as we go, because if I tell you everything now, you're not going to remember. If they feel that they haven't got to chase someone or find out the information for themselves or be left on their own or lost afterwards, and even with the best clinics in the world, that you don't really have a designated nurse, and I do know some surgeons do have one nurse and that they're very fortunate, and that nurse has worked with them for 20 years. And, they are sort of providing this service within what they do. But this isn't normal for most clinics, and actually, I guess what I do is quite unique, because I did set up a 24/7 service for patients, which sounds crazy. But I guess that's, my personality is a bit like, let's push this and see what we can do with this. But I think if you give people that, then they actually feel more relaxed. Yeah. So in 3.5 years that I've run this, I've only ever had 3 phone calls in the night. So when you say a 24/7 service.
That's what I was going to ask you about, is how's it going? Because I imagine yourself being disturbed at all hours of the night.
No, I feel well-managed patients don't actually, and again, I know which patients have got what going on, or those saying that, quiet patients are happy patients. So, so I do touch base with patients at designated points, but also the ones that need a bit more support, I don't standardly do a week 3 call. But if a patient needs the week 3 call, and that week 2, they're still a bit anxious and they're still got something going on, and sometimes I've looked after patients. It's meant to be an 8-week service. I do try and do some discharges for my CQC registration, because I get in trouble if I don't. But, I have had patients that I'm still contacting or still in contact with 6 to 8 months later, because recovery is not a straightforward journey. And it's an emotional roller coaster.
And do you, just going back to the pre-op, because you get to know them pre-operative, because we will tell you that, look, this is a patient that's been listed for Nav's theatre.
Yes.
I can't quite know how you've got access, but that's going to be individual anyway. But but have you spotted patients that you've then gone, are you sure, Nav? Really? So again, without getting into specifics, has that been useful? Do you think?
I do pick up red flags, and it might be something like smoking, for example, and you would do it for a patient's safety, but if patients do open up, I think, a bit more to a nurse, absolutely. And I try and get onto a friendship level with them in a professional manner. So, ones that are trying to quit smoking, for example, might go to me, I was meant to quit, but I did have 2 today, and I will obviously inform the surgeon, because especially with the bigger procedures, it's going to affect their wound healing afterwards, and they're not going to be happy with that afterwards. So, I think that it's really important to pick up red flags, or a vulnerable patient that I'm a bit worried about as well, where, I haven't actually had this situation, but, why have you made this decision to have surgery? If someone said to me, my boyfriend wants me to have it done, that to me is absolutely, that we need to talk about that, exactly. Should we book another consultation with your surgeon? I think you really need to talk this through, this isn't something you should be doing for anyone else.
I think that's such a useful thing to have. And one of my PAs used to work for Harley Medical Group as well. And again, and my other PA, similar kind of background, and both of them are really good at kind of, spotting some of the red flags, even perhaps before I've seen them, thankfully.
Yes.
And we can try and sift them out, because I think that's really important.
It is.
We talk about conversion rates and this and that and the other, but actually what you really want to do is to spot patients that are not going to be happy or are not going to gel with you.
Yes.
And you don't want to treat as a surgeon. It might be that somebody else can treat them perfectly well. There's horses for courses. And I think your service, along with, good PA is invaluable. So that's all going well. And what we'll do is, again, for all of the surgeons who are watching, and people that you might want, people that might want to hear about your services and perhaps use you, we'll put links in all of the various descriptions for this. It's going to go out on YouTube and Spotify and Apple Podcasts and that kind of thing. So we'll make sure there's links and contact details for you. We won't go into pricing. Let's not talk about that now. Because it's probably not appropriate, and it changes and evolves as time goes by anyway. Yes. But personally, I think it's money really, really well spent from my point of view. I've always been happy. I would encourage others to do the same.
Yes.
So, okay, so where now you mentioned your personality as being, not minding providing the 24/7 care and so forth, even though it hasn't come to that. But tell me a bit about, again, as personal or as not personal as you want to be. What do you mean by your personality?
I think I am someone that perhaps, I quite tunnel vision, I would say. And sort of if I'm going to do something, I'm doing it with passion wholeheartedly. Yep. So I think providing this service is part of my passion.
Yep.
I'm a nurse. I love what I do. How can I do what I want to do in the NHS, which you just don't have time to do? Yep. And so I came up with a really random idea to do this. And, that is in the rest of my life as well. I'm really into sports.
That's what I was going to say. I think that's, you're very athletic.
Yeah.
So tell us about that side of things. Again, you don't have to tell us about your personal life if you don't want to. But, tell us about the other side of
So Laura. I think when it probably was about 6 years ago, I started to get into sports quite a lot. Obviously, having children young, you miss that sort of, my life wasn't very carefree. I was raising children and trying to study and work. So, that was challenging. But about 7 years ago, I guess I had a bit more time. My second child was a bit older, and, I started to find myself, and I realized I had quite a personality for long distance running. And I could do it.
Is that when you started it? You hadn't done it before?
I hadn't done it before. Okay. I mean, I was good at athletics at school, but again, I'd never really been able to trial it out. Yeah. So I just started running and realised I could pretty much run all day quite easily, which was quite a skill because a lot of people were like, really?
I hate running. I can cycle. Cannot run.
No, and that's how lots of people feel. So, but I really enjoyed it and just ended up doing marathons and then some ultra marathons. Okay. And then while I was setting up this business as well, I mean, I have been running and answered phone calls because, again, although the turnaround should be about 5 hours that I say, or, phone me if you really need me. But, I will answer my phone anywhere.
Yeah, cool.
So,
amazing. I'm guessing that someone that's determined, I've met other people that, who are bodybuilders and that it takes a certain personality to stick at it and reach your goal.
Yes.
I wouldn't say I'm necessarily one of those people. That's why exercising for me is a little bit more of a, I cycle because I can cycle from A to B. I have to get
efficient.
From A to B. Yeah, exactly. Well, I have to do it, otherwise I'm not going to get to work, that kind of thing.
Okay.
So that's how I end up having to exercise because I've never been that into the gym and I was never very good at sport at school.
I think I like a challenge, and I did do a bodybuilding competition once, but I probably wouldn't necessarily do one of them again. I mean, never say never. I needed to know I could do it. Yeah. The discipline, the training, just reducing the food's really hard. I like food.
Yeah, okay.
So that's difficult, but, I like to see if I could do it. No, and cool. I like to see what you can do with your body as well. Cool. So
I guess let's talk about the future.
Yes.
Okay, not necessarily about whether you're going to do bodybuilding or sport, or whatever, but you're welcome to tell me about where that's going. But where do you see your business going now, your service? Because am I right in saying you don't necessarily work alone? I've met the other Laura as well that you partner with, but I've never quite understood the partnership. Yeah. So I don't know. Tell me what that is, I guess, and then we can talk about where it's going.
So I've got plans for the future. I mean, I think when I set this up, you've got this idea that you're going to have this big net. I'm sure you had it with building a clinic. It doesn't, life is a bit different to that. And
it never quite works out the way you'd set out.
It's really tough, and also I think providing a service like this, it's difficult to, you get maybe some more surgeons on, you need to get some more nurses on. I did actually have a nurse that was working with me, but unfortunately she passed away. So that was really sad. So that took me a while to get over that, because I really wanted, she was someone that lived near me, and she, you know, really sad story. And then obviously Laura and I sort of decided to collaborate last year. She's in medical sales. So the idea will be that in the future we are looking to sort of make this a bit more of a business, I guess, where there's some more people on board, some more surgeons, and just really getting it out there that actually this service is really important for patients. So, you know, there are sort of plans to sort of do that, but she's got a full-time job as well. So it's quite slow at the moment, understandably. So, yeah, I mean, going forward, I would love to see this, you know, take off with more nurses and more surgeons. I'd actually quite like some other nurses to understand how to work for yourself, because I know lots of nurses do the aesthetic side of things, where they're aesthetic, you know, I don't do that. I run a virtual service, which is a bit of a niche.
You've been, I mean, I would classify you amongst a lot of people that come through this podcast as quite entrepreneurial. And I suspect that's probably what you're saying isn't typical of a nurse. Is
no. And it is. And I mean, I think nurses are understanding a bit more, but you know, I've been in, when I left a hospital setting, when I was about to set this up, and I said, I'm going to set up this business, people look at you like you're mad. Well, you can't do that. You can't work for yourself as a nurse, you know, and you can. So I would love to see other nurses do this, because although it's a tie, you know, and it's hard, you know, because I never get a day off. I don't really know when I have a day off. You know, I'm always available and on call, but I'm a mum, so I'm always available and on call anyway. So it's not, you know, it's manageable, but that wouldn't be for everyone. I think some people have the personality where they want to, you know when they're going to get annual leave and take annual leave and not answer their phone. I don't have that. That's what you lose from.
So would you have you taken this out to the nursing community? Because I've seen you at BARPS and the nursing day that happens there. So what's your plans for rolling this out to all of your colleagues that should be doing this?
So I think that I need to build the service to a point that I can't cope with the capacity. And every time I feel like I'm getting to that, you know, we have a slow few months, as everyone knows, it's live. So, you know, it's about not building it to capacity so that I can still cope, but then being able to, you know, I've got some nurses in the pipelines that are ready at any point that I need them. And then the other thing I'm looking at doing a sort of training program for some nurses, because again, I think that this industry is quite under. So I have started writing this training program at the moment, which I think would be good to have for nurses which are learning this industry, because the other problem we have is it's very hard. I've had this sort of vast experience where I've worked, I think some nurses have only worked for one surgeon, and they might have only done the after stuff, you know. So you do need this sort of
variety,
you know. So there's lots of things. I mean, I would love to, you know, I'd love to have lots of nurses doing what I do, because I think it's brilliant. But the reality is, you know, trying to fit everything in your day is quite hard, isn't it? I have loads of ideas.
And have you found a group of nurses that have been coming to you saying, "Look, show me how to do it"? I mean, I guess my I would probably get them stuck in now a little bit, you know, even if they say don't quit the day job.
No.
But you can still do this whilst you're doing your day job, as it were, you know, just to make sure that you're not neglecting a sick patient.
Exactly.
But in a way, I've often thought, you know, when should you expand? You know, this is one of the things that we're thinking about in business. And one of the, you know, do we open another hospital? Okay. And no, we're not going to open one anytime soon, because we're still not quite utilizing this one as much as we should. And times are tougher at the moment than they were even 3 years ago, and more expensive. So yes, we are going to wait a little bit longer, but I do wonder about maybe don't quite wait until you're overflowing. It's actually maybe if you have got good people, and because they're rare, I think good people. So I don't know. Do you think you should go a bit quicker rather than waiting, maybe.
And I do know that I have a bit of a perfectionist personality, and I do, when you sort of read or listen to business pod, I always say I'm a nurse. I'm not a businesswoman. I'm trying to learn the ropes as you go. But no, I do agree, and perhaps
I think sometimes I don't know. It's you don't necessarily have to totally buy in and start giving a nurse 50% of your business. But just I almost think finding good people is almost the hardest bit of any business, really. And if you find a good one,
you got to keep hold of them. And I completely agree, actually. And there are some nurses that I do keep thinking I should just give them some hours, but I guess when it's your sort of baby as well, it's really hard to let it sort of but get the system set up, perhaps.
Absolutely.
I agree.
And so, okay, how. And the other thing I was going to mention also, which it just occurred to me, is that not only do you and I work privately together via specialist cosmetic care, we've also had a bit to do with the charity stuff as well. Be First, which is the charity arm of BAPRAS and has projects around the world. One of the great things, you've been a really big support of Be First, and I'm sure a lot of the people that are listening or watching this will perhaps recognize you from having sponsored some of the BAPRAS curry nights, as we're calling them, the BAPRAS Be First curry nights. So I think we've had 2 or 3 so far, and they've been really good, and you've been a really good sponsor of I can't remember whether you sponsored the booze or the food, but
I think it was the booze. I was on the booze.
Good. Thank you for doing that as well, which I think as well goes to sort of show your wanting to be holistically involved in all of this. And I still haven't worked it out, but we need to put you to good use with the Be First projects as well. Because I'm sure some of this remote nursing can be done even in a much lower middle income setting, such as Tanzania, where I'm working. It won't be the same sort of thing, but the principles are the same. It's gaining the trust of the patient, staying friends with them, supporting reassuring them. They know that you're there if they need you. It's a bit like knowing that, your parents are asleep next door when you're a kid. That makes you sleep better. You don't necessarily have to keep disturbing them. So I wonder whether we should look at rolling that stuff out abroad. I'll have a think about that. That's something that
I mean, anything you can do, along those sort of lines I am always very keen for, because, I think when you do something for passion, obviously it's a business and you have to earn money, but I think giving back is really important.
Yeah, no, it's really good. So thank you. 10 minutes. Thank you.
Probably about 50 minutes.
Okay, we're going to be going longer than I thought, actually. Okay, good. Cool. So, I mean, we've been talking for quite a while now. So, in terms of the future, it's great to know that you're hoping to roll this out. And let's talk about trying to go global with Be First. That'd be great. I guess before we finish up, first of all, thank you very, very much for coming. And I know you've come an awful long way, and I kept you waiting for a long time as well. Sorry, I overran hideously, which is why I haven't taken my hat off, because got theatre hair. But anything that you wanted to talk about first of all, have I missed out something totally, a big chunk of, I wish you'd asked me about that. So this is your chance to is there anything that you want to talk about?
I think the main thing for me is just getting across I think there is still a lot of people that don't quite understand what this service provides. And I think some surgeons just think, well, my patients don't need that, which I think I find really sad still that, I'm still trying to work out, and I have spoke to lots of marketing people, how do you try and show people how important, I know you really appreciate it and understand the concept, but there's lots of people that aren't as dynamic as you.
I've wondered whether it's just because I grew up, once I became a consultant, I ended up working for Harley Medical Group, which wasn't necessarily part of the plan, but I did. And actually I saw that you might be able to criticize them for all sorts of things, but we won't go into that. But what I would say is the system they had in place, certainly post PIP, which is when I joined, and it's obviously when you worked for them as well, was really robust. I thought they had good governance, they had good pathways. The patients.
Just like going from they had good governance.
They had good governance. They had good pathways. The counselling beforehand by people like yourself, I thought was really, really good. They sifted out the time wasters. They prepared the good patients well, and actually that meant that we could be really, really efficient when it came to the surgery. We were doing crazy numbers of cases and doing it well, safely in the right patient. And that's almost what I would say to my colleagues in the way that I've kind of gone around trying to tell people, don't write off these companies necessarily. Do it properly with them. And, there's an awful lot that we do that a lot of the previously, some of the cowboy sector perhaps didn't do. And that's probably what my colleagues are worrying about when it comes to you. They're probably thinking, it's all well and good, but I do it properly. And in a way, I would actually say, you need to be a little bit more open-minded. It's not actually that just because you are a BARPS, BAPRAS, FRCS Plast, NHS consultant, UK trained, based, insured, etc. All the things that we say, the tick box, the checklist that we go on about. Yes, very, very important, but there's an awful lot to be learned, I think, from this sector, the private sector, that we've never been exposed to. And I guess I happened to be exposed to it, and I had a really good experience. I really did. I'm very grateful to Harley Medical Group for getting me to where I am now. And I'm sure you're kind of saying the same thing.
I think I am. And I think Harley Medical is a really good example, actually, of again, a really good service. So the patients always felt very supported. And I think, that's probably why you came up with this sort of concept, really, because Harley Medical Group did get that right.
Yeah, I think they really did. I mean, they possibly didn't make enough money from it.
No.
And you could, I wonder whether we do as well. But that's a different story. But I think they really did get the systems and the pathway right.
Sorry, one second. Just hold that thought. I think that should be better.
I think they really did get the pathways, the systems right, actually. And I still try and emulate a lot of those, which is why, I kind of embraced your services. So, okay. And before we wind up, it's my kind of, try and catch you out question, which is, if you were going to go back...
Just ask the question again.
If you were going to go back to Laura in the oncology day centre, or even beforehand...
Yes.
What advice would you give her? And pick a point before you became a nurse, before you quit the NHS, whatever, or both.
I think actually trust yourself.
Yeah.
So I think one of the things that I think it's quite bold to, do some of the things that I've done, and I've only done them on a small scale. I'm not, I definitely have got a long way to where I'd like to be.
Yeah.
But I think if you've got a bit of a niche or wild idea, and you're passionate about it, do it.
Give it a go.
It's not going to, it's not always going to make the most money. But if you do something you do love, and I do really love what I do, just trust your gut. I think I could have done this. I could have done it sooner, but then I wouldn't have had the experience I had from working with lots of people. But, I wouldn't change where I'm at.
Because I'm a real believer in, if you do something you enjoy, you do it well.
Exactly.
And if you do something you don't enjoy, you generally end up doing a shoddy job because you just want to go home or whatever.
Exactly.
And so, great. I'm not sure. It's difficult, isn't it? Do it sooner. I'm never sure if that's the case. You are who you are. Your experience is what it is. It got you to that point, and here you are now as a result.
And in any business and any journey you're on, you have to do. You feel like you're not going very fast doing it, but you need all those experiences to to come to where you're
Yeah.
at now. So you can't really skip a section,
Exactly.
can you? So,
Yeah.
you know, I mean, I certainly don't do things perhaps the right way. I
I mean, no one does when
had
you're
a
starting
child
out.
when you're 18 and just go
right.
from there and see,
Yeah.
you know, and that's what makes everyone, you know, and again, probably I was a better nurse after that because I'd actually had some life experience.
Yeah,
So,
exactly.
You
Yeah,
know,
absolutely. So, just finally to people who are listening, if we talk about, first of all, your nursing colleagues, if they're kind of now itching to find out more, or they want to do something like the sort of thing that you've done, how do they contact you?
so on my Instagram,
Yep.
specialist cosmetic care.
Okay.
Or obviously we can put my
We'll put
email.
your email and website links will be on the description.
Website, specialist cosmetic care, and there's my number on there.
Fine.
So
And then same for doctors,
Yes.
surgeons who might want to use your services.
Yes.
Get in touch, find out
get in
more.
touch.
Try it out, maybe.
Try it out,
Yeah.
because your patients will appreciate
Yeah.
it because
Yeah.
they're going to have a better service.
And I think you can start off by being quite kind to them. I remember, we
Yeah.
tried you out a little bit.
We had a
Again,
trial
I won't
patient.
go into specifics,
Yeah.
but I'm sure you can negotiate a little trial
Yes.
or some kind of special deal to start off with.
Yes.
Because I think it works. Actually, I really do think
Thank
it works,
you.
and we're going to carry on using you in my practice.
Thank you.
So thank you. I'm sorry, as I said, to drag you all this way,
No,
but
it was
it's been a
good.
lovely chat.
Really good chat.
And thank you to everybody who's been watching. As I said, links are in the description if you want to contact either of us. And join us again for the